Welcome back to the deep dive. Have you ever thought about how you could tackle, huge global problems without needing a massive budget?
Or how something like clinical psychology might actually be a key part of humanitarian aid.
Exactly. If that sounds intriguing, then this deep dive is definitely for you. We're looking into the work of Dr. Chris Stout.
Right. He's the leader who's not just working in global health. He's really pushing the boundaries.
Yeah, challenging its definition by connecting mental health with, well, large-scale action.
And that connection, that bridge, is really the heart of it, isn't it? That's our mission today. We're digging into the sources to understand his core idea
Right.
that the lines, the boundaries between clinical psychology and global health are artificial. That's his point. Which means you need a totally holistic approach. You can't just treat the mind or the body or the community separately. It has to be integrated.
Absolutely. And this deep dive, well, we wanted to give you shortcuts to understanding how you can institutionalize empathy.
Make it part of the system.
Yes. We'll explore his academic background, how that shaped this interdisciplinary view. We'll really get into his innovative open sourcing model for aid.
That's a fascinating concept.
It is, and we'll look at the proof. Some really efficient examples of impact. I mean, projects started with less than $10. Seriously.
It sounds almost unbelievable, but
Yeah. We want you to walk away understanding how empathy can be, like, baked into an organization's DNA.
okay, so where do we start? The beginning.
Let's start right there. His commitment to global equity. It wasn't just some theory he picked up later.
No, it came from real life, early experiences.
He saw these huge disparities in health, in opportunity, very early on.
Yeah.
And those experiences, they made him realize human struggles are all tangled together.
And it sounds like his mentors really helped shape that understanding.
They did.
They showed him psychology wasn't just about fixing problems after they happen. It could be proactive, a tool for social change.
Right. He started seeing that, mental distress, physical illness, poverty, they weren't separate issues.
They were often symptoms, symptoms of the same underlying systemic problem.
Exactly. That realization that we're all sort of connected in this, it pushed him down an academic path that deliberately broke the usual molds.
He didn't want to stay in one box.
No, he wanted a broader view.
And his time at the College of Medicine at the University of Illinois, Chicago, and then Northwestern's Feinberg School of Medicine. That was key.
How so?
Well, he wasn't just sticking to psychology. He was encouraged to get involved with public health, medicine, policy, global health.
Mixing it all up.
Precisely. And that cross-pollination, it showed him you can't find the best solutions to really complex health problems by working in silos. You just can't.
So if the solutions need integration, the organizations delivering them need it too. Which leads us straight to his big innovation. The Center for Global Initiatives, CGI.
Right.
What was the reason behind starting CGI? What gap did he see?
It really came out of frustration from what I gather. Dr. Stout saw loads of well-meaning humanitarian projects just failing because they were too top-down. They'd come in with external solutions that weren't sustainable, didn't involve local know-how, didn't give local people ownership or accountability.
Okay, so the classic model wasn't working. And his fix was this idea of open sourcing humanitarianism, which sounds radical.
It is pretty radical.
If I asked a big traditional NGO for all their internal strategy data, they'd probably show me the door. How does CGI actually do radical transparency?
It's about flipping the power dynamic, really. Open sourcing means transparency, yes, but also collaboration and making everything accessible.
Accessible how?
It's not like traditional charity, where money flows one way and decisions are made far away. CGI focuses on distributing expertise, sharing resources, data, successful strategies, sharing it all widely.
But communities can run with it themselves.
Exactly, so they can replicate successes on their own terms, take ownership.
But isn't there a risk? Sharing all that data, that expertise, how do they maintain quality? Or protect intellectual property when they're deliberately giving it away?
That's where the academic rigor comes back in, I think. They're not just throwing things out there. They act as a catalyst, a convener, not a gatekeeper.
Right.
They help set up research methods, standardize ways to measure things. But the local partners, they own the actual doing, the adapting. The core mission is listen first, act second. Provide the blueprint, maybe some technical help, but let local leaders tailor it to their own culture, their own economy. They're not building an empire, they're planting seeds of resilience.
That makes sense. When you really institutionalize empathy, when you actually listen first,
Yeah.
The systems that come out of that should be way more efficient.
Yeah.
Dr. Stout often says something like, true success is about lives changed, not budget size.
Right. It's the impact that counts.
So let's look at the proof, these examples.
Okay, we absolutely have to talk about the $8.90 start,
Okay.
because it sounds like fiction.
$8.90.
But the sources confirm it, not a typo. That amount, basically postage and some initial curriculum stuff, was the seed money.
For what, exactly?
For starting a school for children orphaned by AIDS in Tanzania.
Wow. $8.90.
Right.
That's barely anything. How did that possibly scale up into something recognized by the government?
It scaled because the philosophy was right from the start. Instead of, flying in experts and building some big foreign complex.
They empowered locals.
Yes, they empowered a local teacher, someone who designed a learning environment, and crucially, psychosocial support based on what the community actually needed.
Grounded in reality.
Totally. And because that model was appropriate, sustainable from day one, it actually met the tough standards of Tanzania's Ministry of Education.
Ah, so it got official approval.
Exactly. Which ensured it could last long after any initial help was gone. It became a real sustainable institution, education and mental health support.
That story shows the power of just smart, empathetic design. But the next example, this really hits home the efficiency point of the open source model, the malaria intervention.
Yeah, this one, the numbers are just staggering.
Tell us about it.
Okay, so there was a really bad malaria epidemic in Tanzania. CGI got involved, but not by trying to replace the existing healthcare system.
What did they do?
They used local networks, leveraged them to get vital medications and distribute them fast,
Working with the system.
working with regional players, ensuring total transparency in the supply chain. And because of that, they managed to prevent over 4,100 deaths.
4,000 deaths prevented. That's incredible. And the cost. This is the part that blows my mind.
It really is something. You think about global health spending, right? Interventions can cost hundreds, even thousands of dollars per life saved.
Easily.
This program, they calculated the efficiency down to an average of just 73 cents per life saved.
73 cents.
73 cents. And nearly a third of those lives were children under 5, the most vulnerable group.
73 cents per life saved. That number. It should make every traditional aid organization stop and think.
It really should.
It just shows how much waste, how much life-saving potential gets lost in big, centralized bureaucracies.
And it wasn't just a short-term fix either. You see the ripple effect years down the line.
How so?
Those kids from the first Tanzanian school we talked about, they did great on national exams, went on to higher education, and alumni started coming back.
As mentors, sponsors.
Exactly. Turning the whole thing into this self-sustaining cycle of local empowerment. That's real systemic change.
That focus on lasting success, it brings us to this scaffolding model idea. So CGI comes in, but they don't just impose their own plan.
No, definitely not.
What does that listening phase actually look like on the ground?
It starts with real engagement, not just, ticking a consultation box. It's co-design.
Co-design.
Yeah, teams run focus groups, have community conversations, do these participatory assessments where the community itself defines the problem and what success looks like for them.
Okay.
And local leaders, they're brought in right away, not as people receiving aid, but as partners, co-implementers, decision makers. They become the authors of their own success.
So the community is the architect, and CGI provides maybe the tools and blueprints.
Something like that. But then there's the huge challenge in global health, right? Making sure the progress sticks.
Right. That it doesn't just vanish when the outside funding stops. The dependency trap.
And that's precisely what the scaffolding model is designed to avoid. They plan the exit strategy right from the beginning.
How does that work?
Think of it like this. The goal is to build a scaffold, not a crutch.
Okay, I like that analogy. A crutch supports you forever, maybe stops you getting stronger.
Right. But a scaffold, it helps you build something solid, and
Right.
then you take the scaffold away, and the structure stands perfectly fine on its own.
That's a great way to put it. So what are the actual pieces of that scaffolding? What do they build?
It means serious capacity building,
Yeah.
real knowledge transfer, training programs designed so locals can carry on independently.
So it's not just about, say, delivering medicine today.
No, it's about making sure the local community can get the medicine, manage it, distribute it themselves forever, linking up regional supply chains, building partnerships with local government, other NGOs.
Basically, success is measured by how much the local community truly owns it, ensuring the results are sustainable within that place's own ecosystem.
Exactly. When the CGI team eventually steps back, The community should be stronger, more financially integrated, politically empowered to keep it going, not weaker because a funding source disappeared.
Now let's shift a bit. Beyond the fieldwork, Dr. Stout's work reaches into policy, high levels of government, right here in the U.S.
Yeah, he's a really persistent advocate for integrating mental health into federal policy.
And that sounds like a tough fight. He calls it a marathon, not a sprint.
For sure.
Yeah.
And the challenges here kind of mirror the global ones in a way.
How so?
His advocacy is all about convincing policymakers that mental health isn't some secondary issue. It's fundamental public health, just as vital as physical health, deserving serious investment.
But the hurdles.
They're huge. You've got
Yeah.
the ongoing stigma around mental health. You've got funding systems that are completely fragmented, government agencies stuck in their own silos, barely talking to each other.
So he built coalitions
Right.
across different groups.
Big time.
All right.
Providers, advocates, legislators, trying to chip away at that stigma, that inertia, and that persistence. It seems like a hallmark of his leadership style.
So what does effective leadership look like in this kind of work, according to him?
For him, it really boils down to humility and being adaptable. Good leaders have to be, first off, humble listeners. Really listen. They need to be able to learn constantly, adapt to new information, be courageous advocates willing to push boundaries, even take some heat for it.
And comfortable with things not always being clear-cut.
Yeah, comfortable with ambiguity. And recognizing that sometimes progress is slow, tiny steps.
Staying innovative in global health, that must require a similar kind of openness. How does he keep finding new approaches when the problems are so massive?
It sounds like it comes down to intense curiosity and deliberately looking outside the usual boxes.
Like where?
He insists that the best, most efficient solutions often pop up when you mix psychology with, say, technology or design thinking, economics, even the arts. And he's really firm that the best ideas have to come from the ground up, from the people closest to the problems, not cooked up in some distant office.
Looking forward then, what's on his urgent agenda based on these integrated challenges?
Well, mental health is still front and center, obviously, given how neglected it's been.
But it expands beyond that.
Oh, yeah. He sees the really big, complex issues of our era, like the connections between climate change, forced migration, and infectious disease. He sees those as the defining challenges for the next generation.
That's a heavy list.
It is. Plus, health equity, making sure everyone has digital access to care, boosting pandemic preparedness. He sees the next few years as a critical test. Can we build health systems that are truly resilient, fair, and inclusive worldwide?
So for anyone listening to this deep dive, maybe a student, an aspiring changemaker,
Yeah.
what's the core advice Dr. Stout gives?
It's very practical, very human, basically. Be humble, be patient, and lead with empathy.
Simple but powerful.
Yeah. Find good mentors, for sure. But he also advises learning just as much from your peers, and maybe most importantly, learn from the people you're trying to serve. Recognize they are the experts on their own lives, their own communities.
He also talks about needing a strong foundation, right,
Yeah.
in your discipline.
Absolutely. Whether it's psychology, medicine, policy, get that solid grounding, but stay flexible. Always be ready to learn new, cross-cutting skills.
And he warns against burnout, too. Said self-care isn't a luxury.
No, it's essential if you want to stay in it for the long haul. Sustainable service requires sustainable CGI. Ultimately, the legacy Dr. Stout seems to want isn't about him, it's about empowerment. Helping create systems, communities that are just stronger, more resilient because of transparent, shared work.
His career really does show that visionary leadership can transform lives through these sustained, human-centered actions.
Yeah, it's powerful proof.
So here's the final thought for you, the listener.
Yeah.
If that kind of radical transparency, that open sourcing of expertise, can lead to incredible efficiency, like that confirmed 73-cent cost per life saved,
Yeah.
what small, transparent, collaborative change could you make in your own work, your team, your community? Something to cut through unnecessary bureaucracy and maybe achieve that kind of exponential, profound impact. That's the challenge we leave you with.